Today we're celebrating the graduation of our first cohort of Health Equity Fellows and the launch of the second cohort. And this is a program that was started just over a year ago, really to build capacity in the organization.
The Providence Health Equity Fellowship program is an inaugural program for our healthcare organization here at Providence, but at large, it's definitely one of the first programs of its kind.
The goal is to take 20 fellows and teach them how to do health equity in their day-to-day job. Not only were we looking for fellows with diverse lived experience and how they identify and show up in the world, but also what roles they play at Providence.
When we launched this program, we thought, let's get 20 people and see if we can build experts across the enterprise who can be a resource, a support for their teams and their divisions and ministries, bringing equity principles to the work that they do. Not everybody's work, but their own unique sphere of influence. And that's exactly what this first cohort has done all across Providence, from Alaska to Texas to California to Montana.
I think of this as starting a bunch of little sparks across our enterprise that will eventually kind of burn out of control. So health equity becomes the work of all 120,000 and not just the 20 that we started with.
We cannot be more proud of the fellows that are graduating this year, but we're really looking forward to seeing how we can learn from them and excited to see a new cohort of fellows coming in for this next year and future ones to come.
I think if today was any indicator of the impact that this fellowship is going to make, we're on a good start.
Looking at health equity, we talk about what does that mean? Really, in the simplest way, it's making sure that everyone has their best chance to live their optimal life.
Health equity has a lot of components to it. So it's quality of care, it's access to care, it's patient experience.
People have different backgrounds, different lived experiences, and therefore, in order to give them the care that they deserve, we have to be cognizant of those challenges that our patients face.
There's a lot of distrust between our Latinx and our Black patients with our providers and with our health system. In our Latinx patients, there is a huge language barrier. There's a literacy barrier.
Not understanding what the doctors are saying, what the nurses are telling you, and it's another suffering.
As a person of color, as a Mexican, I have always seen the disparities. I started noticing that a lot of the patients that I was seeing, a lot of my Black and Latinx patients, we're not getting the appropriate services that they needed.
I come from a very mixed ethnicity family. My husband is African American. My children are biracial. And so I've seen how people are treated differently when they walk in. Often my husband will send me in to be the spokesperson. And that's why I jumped into this.
Health equity is very dear to my heart. As a first-generation immigrant, I moved to the United States about 9 years ago. And I never forget the time that I had to pick up the phone and make my first doctor appointment. I was shaking the whole time over the phone. The words were barely popping out of my mouth. And that experience really made me want to hop.
When we do this work and we go across the enterprise, people feel like it's overwhelming. I can't solve all these challenges, and it's true. What it also means, though, is that everybody in their corner can do something.
I feel like it is my role to give back. I feel like a lot of investment went into the education that I got and that I am sort of privileged, and it is my job to use that power for good in the world. When I have a seat on the table, I represent my community. And when I'm in the community, I represent healthcare. And I'm trying to be that bridge between the community and the healthcare system to make that change, because I know we could do it.
The big thing that we always push is that we have to co-create the solutions with the community we're trying to serve. That way, you actually come up with solutions that are meaningful to the people that you're trying to serve and that can actually move the needle.
I'm a teacher. I teach internal medicine residents, and every little bit that I can learn about health equity is helping them become better doctors. I require all of them to take the equity lens in the projects that they lead in our community. So the stuff I've learned in the fellowship is going to be paying it forward to the physicians of the future, too.
They have created such powerful, impactful programs by bringing their lens, by partnering with the community, by using data to inform their strategies, and actually they are making a change all across Providence. I am so proud of this work, and I know that it's only going to get bigger and better over the years.
This is definitely a unique program to Providence and healthcare at large. No one else is doing this type of approach. It's very progressive, and it will essentially change the way we approach healthcare.
I think what the fellowship did is taking health equity from being a project or an initiative to being the way that we do work at Providence, to being just as integral to who we are as our mission, our vision, and our values. And that's it, right? I mean, health equity is healthcare. And I think we now have 20 more people that can do that and take that into the world.